How's your mental health these days? Well, that might depend on how conservative your parents are. A new report from our next guest, Jonathan Rothwell, indicates that on a number of vectors, conservative parents perform better with their children than their liberal counterparts, leading to better mental health results for their kids. Rothwell writes, parental political ideology is a strong predictor of parenting style. Liberal parents had the lowest scores, meaning they were the least likely to endorse items indicating warm, disciplined parenting. Just 40% of liberal parents scored above average on the index, whereas 71% of very conservative parents and 56% of conservative parents did. As with parenting practices, political ideology and attitudes towards marriage are also strongly predictive of parent-child relationships. Very conservative parents, on average, enjoy the strongest relationships with their adolescent children, and liberals experience the worst. The difference is large and statistically significant at 95% confidence levels. Conservative parents are 8 percentage points more likely to be in a good relationship with their adolescent child than liberal parents, and the gap is 14 percentage points between very conservative and liberal parents.
Rothwell's research led him to conclude that adolescents with very conservative parents are 16 to 17 percentage points more likely to be in good or excellent mental health compared to their peers with very liberal parents. Only 55% of adolescents of liberal parents reported good or excellent mental health compared to 77% of those with conservative or very conservative parents.
Here now to discuss his findings is principal economist with Gallup, Jonathan Rothwell. Welcome to Rising. Thanks for joining us. Let's start by breaking down why exactly this might be. You point out that conservative parents are more likely to adopt what has previously been referred to as an authoritative parenting style. First, what is an authoritative parenting style, and why do you think it is conservative parents and very conservative parents in particular that might be more likely to take on that style?
Well, the style is characterized by demandingness and warmth or responsiveness. Those are the two dimensions. Demandingness or lack of demandingness is one dimension. The other is warmth or coldness. And this style was developed in the psychology research literature by Diana Baumrind, Eleanor Maccoby, and other psychologists in the 50s, 60s, and 70s. It's been documented through hundreds of studies since that this style is highly predictive of depression, anxiety, and other forms of mental illness. And the optimal style is called authoritative by Baumrind, and that combines the expectations and high demands that a parent brings when he or she disciplines and enforces rules and regulations with the warmth and responsiveness that comes with child-centeredness.
So if I were to explore some kind of relationship between sunburns and human behavior, I could find in the data, if I conducted research, that it seems that everyone who ate ice cream one day ended up having a sunburn. And then I concluded that maybe eating ice cream causes sunburns. I would be overlooking the fact that people tend to eat ice cream when they're outside in the sun, enjoying a warm day, and it's actually the sun that causes sunburns. What, if any, confounding variables did you look into in the research here that conservatives may be more likely to not report when they're experiencing mental health problems, that it's a part of the culture to either not recognize mental health problems as real or to sort of mask them to seem strong? What variables did you look into other than parenting style that could explain this correlation with conservative parents and high reported mental health status?
Great question. So quite a few is the short answer. We looked at education, household income, race, ethnicity, the sex of the parent, the sex of the child, the age of the child, subjective reports of how comfortable their standard of living is from the parent's perspective. We also looked at mental health measured by what the youth reports versus what the parent reports, and found that they were well aligned. And I'd also say that we're not the first to identify the relationship between liberal adolescence and mental health problems. This has been something that the social psychologist Jonathan Haidt has written a lot about recently. And of course, many psychologists have documented the alarming rise in suicide, depression, and other mental health problems that we've seen over the last 10 years among adolescents in the United States.
It's also my understanding, Jonathan, that while conservatives might be less likely to seek treatment for things like mild depression or mild emotional disorders, they're actually more likely to seek treatment for severe depressive disorder or severe anxiety. Is that accurate?
I can't say that I've come across that literature, and we weren't really looking into that in a great deal of depth for this report, but I can tell you that in addition to the subjective items where the parents are describing mental illness symptoms of their children and the children are reporting their level of well-being, we also documented that those subjective measures are highly correlated with whether or not the child is currently receiving psychiatric medication and the probability that the child has recently visited a doctor to discuss psychological problems.
So I'm curious, were urban and rural areas also considered in the confounding variables list? I don't know if I remember you saying it. I can imagine a world where, we see a correlation currently in the data and voter trends of participation in Republican primaries and voting more conservative in rural areas, and also oftentimes an increase in actually mental health issues in conservative areas. A lot of these, towns, small towns across America have been left behind by a lot of industries for, this sort of urban sprawl. We've seen this trend to be in more urban areas. Likewise, we see a trend for urban areas to be more liberal, but I can definitely recognize that living in a, urban versus rural area could contribute to a child's mental health. Did you look into the rural-urban divide at all in the research or find any trends there?
We didn't have quite enough sample, I'd say, to look in great depth in rural versus urban, depending on how you define it. There didn't seem to be any large differences by educational attainment, socioeconomic status, though, surprisingly. So other work, notably by Ann Case and Angus Deaton, two Princeton economists, have found that deaths of despair have increased quite a bit among less educated white Americans who tend to live in rural areas. Lately, though, there's been some convergence, as they themselves have noted, and that other communities are starting to see rising deaths from alcohol use, drug use, accidental overdoses, and suicide, even in many urban areas. So it seems like that may have first sort of spiked in rural areas, but is now very much an urban problem too. And that applies to adults who are middle-aged. These trends that we're seeing are, in terms of mental health decline, are concentrated in adolescence in terms of rising depressive symptoms of depression and anxiety. And I think it's well established that is happening very much in urban areas as well.
Your study also looked into the potential negative effects of what you call adverse effects on the mental health of adolescents. Can you walk us through what some of those adverse effects you looked at were, and how much can a good parenting style mitigate those negative effects?
Sure. Yeah, great question. So, of course, losing a parent to death, or having a parent move out of the house because he or she has been imprisoned, or through a divorce that may have gone very badly and that parent is no longer considered part of the family or household, can be traumatic for the child. Feeling rejected or abandoned by a parental figure could be traumatic for the child. Those are some of the things we asked about, in addition to how safe they feel on a 5-point scale. And those sorts of questions come from measures that were developed by the CDC and fielded on some of their surveys. And they are correlated, as you would expect, with the adolescent's mental health. And so avoiding those is important. But what we do find is that the overall quality of the relationship with the parent is far more important. So, and this is the parent who's reporting on the survey, not necessarily all of the parents that are in the child's life. But a strong relationship with that parent has a bigger effect on their mental health than those kind of self-reports of losing a parent or feeling rejected by another parent.
I find it interesting, this quality of parent-child relationship, that there was actually no real correlation measured across socioeconomic status. That socioeconomic status or the family's household income was not a determinative factor in the parent-child relationship. Can you just speak on that finding a little bit?
Sure. In general, the parenting style didn't really differ by socioeconomic status, which was also surprising to me, but consistent with work that's come out of the Bureau of Labor Statistics when they've investigated parenting relationships and long-term effects on adolescents. So there does seem to be a robust finding there that parents are not necessarily better or worse in terms of their warmth and demandingness if they have higher or lower levels of education or household income, which to me is a very encouraging finding that suggests you can't buy high quality parenting and high quality child parent relationships. It really comes from complex combinations of sort of the culture, how you were raised as a child, how you understand what it means to be a good parent, and even if someone had necessarily a difficult childhood, they're not destined to be to have difficulty as a parent. We do see that there was some relationship there, but it was not very strong. And what was much stronger in terms of predicting whether you have a good relationship with your children was how well you'll get along with your spouse.
And just one quick final question for you, going back to your answer about deaths of despair between rural and urban areas converging. What is your definition of an urban area, just for our viewers to understand?
A city, population of several thousand. I think the census definition has a pretty low bar, but I'm thinking of really the large metropolitan areas in the United States where you typically have 500,000 residents in the city and suburbs together.
Perfect. Thank you so much for clarifying, and thanks for joining us on Rising today, Jonathan Rothwell. Fascinating study. Thank you.
Thank you. Bye-bye.